hit that. Okay, and we are recording, and this will be shown on the LSU Health Foundation website and on our social media channels if you're looking for this later.
Okay, great. Yeah, because I know some people may not be able to attend right now, so that'd be good.
Okay. All right, Crystal, do you want to get started?
Yes. Okay. So make sure you post your questions in the chat feature because we will be taking questions throughout our webinar this afternoon. Hello, everyone. I'm Crystal Oliveira, the Chief Development Officer at LSU Health Foundation. Thank you for joining us. This is our third webinar on COVID-19, and we are here today with Dr. Summer Marshall. And she is a family nurse practitioner who's going to talk to us about what LSU nurses are seeing on the front lines. As we know, nurses are some of the most important first responders, and we couldn't be getting through this pandemic without them. Dr. Marshall, welcome. We're so grateful to have you here. Thanks for taking your time. Would you share with us briefly what's going on out there and how is life in the world of an LSU nurse?
Hi, yes, thank you for having me. I really appreciate it. So it varies between facility, but from what I've seen when I had students with me, it's a lot of mixed emotion. It's a lot of, they want to help, they want to get out there, but they're still in that learning curve. So a lot of times they're not sure, you know, what they should be doing, especially with a virus like this. So a lot of the patients that come in may not necessarily be coming in as COVID positive patients. They may just be rule out, or they may be coming in with other symptoms and not even considering COVID-19 being a part of their diagnosis. So, but the students are very quick to learn. They do pick up things very quickly. So they'll go into, you know, patient's room. We're protected. We have our N95s. We were fit. All of us were fit tested, and we have the surgical mask over that. Now, if it's a patient who's a rule out or positive COVID, we'll also have the shields and the the gowns. But if it's not a rule out or a COVID positive patient, we will just have our N95s and our surgical masks. And a lot of the patients do wind up being tested. They come in with other disease processes, but then they wind up showing symptoms. It's just very contagious, so it spreads very easily. It's hard to really keep it contained. And this is one reason why I think the nursing students provide a great service to the patients, because they can't have family members in the hospitals. So I think the nursing students have the extra time that the staff nurses don't have to provide compassion and like maybe comfort and, you know, a listening ear to patients who are scared, especially if they test positive or they just are alone in the hospital with something else going on. And the students really, really enjoy that role as well as the technical skills. You know, a lot of the student nurses who have, you know, expressed a little concern is just because they live with their family members who may be immunocompromised, but we just educate them and teach them how to protect themselves in the environment, as well as when they get home, how to be cautious. And I think that that eases their anxiety and comfort levels a great deal. But they're very excited to help and eager to learn, because they know when they graduate, this is something they're going to be doing for the rest of their lives. So I think that, you know, when they find out that they can actually learn hands-on, it really helps a lot.
Great, wonderful, thank you. Where are the majority of the students at LSU right now?
Well, we were all over the place about, I guess, a few weeks ago, maybe a month ago. No, just a few weeks ago. And recently we were redirected to West Jeff, and now I think we're being redirected to East Jefferson. There were also some talk about Convention Center and some other ideas. We're just trying to go wherever we can actually help or where we're needed. It's a little tricky because the PPE, you know, they're conserving it, and they just, you know, want to make sure that, you know, there's enough for everyone to protect themselves, as well as, you know, provide the PPE that the staff needs as well, but they're finding ways to actually reuse it where it's safe. So they have the UV lights. I know at some facilities, they have the UV lights where they'll hang it. When they go to leave, they'll have it in a paper bag, hang it in the UV light, and it stays there until their next shift with their names on it. That's one way that they're finding. Also, there was some other information. So with the surgical mask on top, if that, you change that out more often rather than the N95. So, and they're actually lasting pretty long. So if you take care of them. So right now, the students we are moving, we're in transition right now. So this past week, we're not actively in any hospitals.
But you guys are moving. You said there was some talk of the convention center. Can you tell us a little bit about what's going on at the convention center or what the plans?
Well, the convention center is becoming an overflow for COVID patients, and there was some talk, I'm not sure exactly, I just know that they expressed that they may have had a need, and we were ready to fill that need if they asked us. Okay. I don't know too much about it though.
Yeah, okay, great. I had read an article that they are outfitting that to take COVID patients over there, so that's great. And you said a lot of the nurses are doing telehealth, or we're working towards the nurses participating in telehealth?
Oh, that's for the advanced practice. Some of them are doing telehealth. A lot of the stuff is trying to be remote, just screenings to prevent patients who may have regular appointments from going into the office if they have symptoms. If we feel like they're well enough to stay home and self-quarantine, then we will recommend that, and then just follow up when things calm down a bit. Or if we feel like they're very symptomatic, say they're having shortness of breath, or burning chest pain that comes with the COVID, to go to the emergency room to be evaluated. But we're trying to keep them out of the office because we're trying to save those appointments for patients who need to be seen, who are not presenting with possible COVID. It's still a hard balance because a lot of people in general can be asymptomatic. So they're promoting for everyone to wear a surgical mask though, to try and contain things.
Yeah, okay, great. How long have you been with LSU?
A little over 3 years.
Okay. And you teach a lot of courses as well as being a family nurse practitioner. Is that correct?
Yes, that's correct. On different levels as well.
Can you talk about that a little bit?
Yeah, so my major, my heaviest course, I would say, is the adult health cohort, which is the theory lecture part, the lab where we go into the hospital lab and practice skills before going into practicum, which is the clinical environment, the hospital environment. That is the heaviest course I have. I also am part of the team in the genetics course, as well as RN to BSN course, which the RN to BSN is where the students they're already registered nurses. They already have a license, but they're pursuing their bachelor's. So it's an RN to BSN program. I also teach in the accelerated program, which is called the CARE program, which actually adult health has both traditional and CARE right now. And then also in the graduate program, I'm second chair on two students' DMP projects. So we do a lot.
Yeah. And how does something like the coronavirus, how is that shaping, the education of these new nurses coming in? What is that environment looking like that maybe wasn't there, a few months ago?
Oh, remote learning has been a huge transition. We've learned it very quickly and implemented it very quickly. And I would have to say faculty and students, we transitioned within less than a day. It was almost like we didn't miss a beat. It was amazing. So it's been going fairly smoothly considering the number of students that we have versus faculty. But all the faculty have really been just really stepping up, and the students are adjusting so quickly. And we've had a few bumps, but IT is amazing. Like I can't even express how amazing IT has been, the support from them and just the help and the patience with us to help get us through that transition. But it's all remote. And they're doing really well. It works really well. It really does. I've enjoyed it. And the Zoom lectures, I've really enjoyed. I feel like the students are extremely attentive. And questions, I think it's more personable actually because of the questions. It's more face-to-face now instead of a huge classroom with 100+ students when it might be somebody way in the back asking a question. It's more face-to-face now because, as you know, for Zoom, when they speak, it highlights them and their name is right there. I really enjoy it. That was the biggest transition, was the remote learning.
Yeah. Well, I just can imagine, the coronavirus has changed my life significantly.
Yes.
And I'm not on the front lines in any way, shape, or form. And I just wonder, what is that education looking like now that we have a pandemic, now that, coronavirus is such a big deal and it's upended our economy, our lives, the way we used to go about a normal day-to-day, and just how that impacts a student who's learning to become a nurse and while this whole epidemic is going on.
I would say the biggest impact, I think, is more emotional than anything else. I think the uncertainty and the fact that there's no cure yet or no vaccine or actually really no treatment. So I think that's a little confusing for them because, all the disease processes that we teach them, there usually is some sort of history behind it, research out there, vaccine that we want to promote or a procedure policy that we follow to treat it. With this, it's kind of just guesswork. And, all the nurses that I've spoken to that are located throughout, the New Orleans area have said the same thing. ICU nurses, ED nurses, med-surg floor nurses, that it's trial and error right now. So I think that's a hard thing for the students to grasp because they really like black or white, because they're studying for tests, they're unsure. So they're wanting like a specific answer on how to take care of a patient. And with this, there really isn't anything specific that we can tell them right now except to monitor for symptoms and then go from there. So if they have respiratory symptoms, how to treat respiratory symptoms. So we just try to keep it simple for them and break it down. But there is an emotional toll as well. When you see a patient that is fine and walking and talking, and then the next few hours they're crashing or they pass away, that's something the students, we like to debrief them on that because it may be their first death. And I've had students tell me this is the first death I've ever witnessed, that I've ever had to deal with and process. And so as faculty, we're them for that as well, to help debrief them and help them process that. And of course, we have our campus assistants if they need that as well, and we can refer them to them. But most of the times, I think it just takes a little time for them to process. So now I think, they really are resilient and our lives have changed, but the students truly are amazing. I mean, they're really just ready to go. I mean, they're doing their work. They have their anxiety and stress elevated a little bit, like right after, but now, I mean, we're just working through it. And I think finances are a big issue. A lot of our students have families and their husbands may be out of work or their wives are out of work, or they have family members that they need to support now because they're out of work. So I think there's a big financial strain. And if students have had to withdraw because of their children being out of school, because they're just not able to do both, that they've lost that money from the semester, the $5,000 or $6,000 or whatever program they're in. It just depends. It could be $8,000 for the semester that they're not going to get back, but they've just had to do what they had to do for now and then hopefully return in the fall or summer to continue their education. So I would say emotional and financial strain is the biggest adjustment I think they're really struggling with. So, but they are pretty resilient and amazing overall. I'm very impressed, especially some of them are really young, 19, 20, 21, and they're truly amazing.
Dr. Marshall, we have a question.
Okay.
Someone is asking, can you tell, and it's right along with what you were saying, can you tell us what the nurses do daily to maintain their emotional stability when faced with this?
Every student is going to be different. Some of them have discussed, meditation, exercise. They all like to nap. They watch a lot of Netflix, so they get in groups. They are very supportive of each other. Faculty is always there for them as well. I think it just depends on the student. We always try to promote, mental health with them, as far as don't forget self-care, try to eat right, try to do some sort of exercise, whether it's walking your dog or riding your bike around the block. I know that we're self-isolating right now, but try to get out at least a little bit, a couple times a day. Don't just sit inside all day studying. Take your breaks, make sure you stay hydrated, and do some self-care, do something nice for yourself, whether that's a nice bath or binging on a Netflix series, or whatever you feel helps your whatever helps your mental health. And if you can FaceTime with family or support your support group, you can't see them in person, but you can FaceTime with them. You can the WhatsApp, I think, for people who don't have Apple phones, they can do that. So we encourage them to do all those things if they can.
Well,
and if they really need, I'm sorry.
No, go ahead.
I was gonna say, and if they really, need help, we definitely refer them to CAP. They are amazing. They're very helpful, and the students and faculty can reach out to them either anonymously or schedule an appointment. They are doing Zoom appointments too, since we can't meet in person.
Okay.
They're a great resource.
What is CAB?
Yeah.
That's the Campus Assistance Program. It's social workers, and I think it's, I want to say therapists or counselors. I'm not sure the credentials, but they're there to listen and be supportive and help. It's private. It's, basically like patient provider scenario. So everything is confidential unless, there's an issue with, suicide or homicide. And they're there, and there's a 24-hour hotline. If so, say a student or a faculty member, 2:00 in the morning is just having really bad anxiety, they can call the number and have someone to speak to. And if they want it to remain anonymous, they can. They don't have to give any of their information. It's and it's for the entire school, not just the School of Nursing. It's for medicine, it's for dental, it's allied health. Yeah, they're a great resource.
Someone is also asking how we can support our nursing students at this time. Is there anything that the public can do?
Try to understand why we need y'all to stay home. And the surge is making it very hard because we're overloaded. And so if we can, the flatten the curve, I don't know how many of you have heard that term. If we can kind of get those numbers down, it will allow our staff, our nurses, our students, everyone to maximize healthcare at this point. Because when we have too many patients and our nurses are getting sick and we're short-staffed, the ratios change and not in favor of the patients. And so I know it's hard to understand why it's so important, but if we could just keep the admission rate to a certain level, it will definitely help all the patients and the staff, because we do have staff that winds up, very sick and ill, and they're not able to come to work for a while, and the patients are still coming in. So to be supportive, it's best to, just listen to the advice of, trying to stay home, only go out when you need to, hand hygiene, wear, a surgical mask. Even if you're asymptomatic, you don't know if you're still carrying. So just, try not to spread, minimize your exposure. Don't congregate in big groups. The family members, as far as being in the hospitals, it's very difficult. And we all do understand that, not seeing your loved one, especially if they're in ICU and they're critically ill, is a problem, and it's upsetting. But to expose you and then the rest of the public to something that may be otherwise prevented, it's just basically outweighing the risk with the benefit. And I do know that some hospitals, for their ICU, there is a facility that if they know that their family member is going to die, that they are allowing family, I think 1 or 2 family members, to come in for just a few minutes, which I think is really kind, but they
Oh,
do
wow.
have,
Yeah.
yeah, they do have to gown up and be like, they're trying not to spread it, but at the same time, they're trying to show compassion. So not really sure how that's working out. I think so far it's okay, but it's just such high risk for the visitor to contract it, especially when a patient starts declining. And if there's any resuscitative efforts, the virus becomes aerosolized. The more viral load in the air, the higher risk you are for contracting it, spreading it. So it's very complicated, and it is a lot to ask, but it's just something that we really need support for right now.
Okay. Someone is asking, what advice would you give nursing students who may be interested in nursing but are having second thoughts due to the direct vulnerability they feel right now?
I think that that's a common feeling. I think that nurses a lot will second guess their career. I don't think it's a new thing to nursing at all. I know throughout my nursing career, since 2007, I've reconsidered and thought, am I doing what I should really want to be doing? And then the answer always is yes. I can't imagine myself doing anything else. But times do get hard, and that is part of being a nurse. That it is hard at times, but it can also be very rewarding. And if you are second guessing, or if you know someone who's second guessing, the threat of the coronavirus is very real. And the best thing for you to do is to educate yourself on how to protect yourself by proper PPE equipment, stay up to date with all the research that's out there. It's better to be more on the side of caution than exposing yourself. And also, there's so many opportunities in nursing. Just because you graduate with a nursing degree does not mean that you have to work in a hospital. You could work in legal nursing. You could work in clinics. There's a need for nursing pretty much everywhere, a school nurse. So there's a lot of opportunity out there. So I say don't give up just yet. You know, try it out, see how it goes, and, you know, consult with some of your senior nurses and see what they say and see what their feedback is. If you have any mentors, it's really great to have a mentor in nursing because it is a hard career. So just seek out some mentors if you don't have any, and if you do have some, definitely speak with them about your concerns. And one of the faculty at LSU, Dr. Leday, and I are actually trying to create a like a listening group, kind of like a support group where, you know, students can just express their concerns and stuff. So we haven't actually got that going yet, but it's just something that we're thinking about, especially with everything that's going on, just to have a place for them, a safe place for them to go and just kind of talk about their experiences and stuff, and just have some, you know, senior nurses listen and, you know, provide positive feedback. So.
Okay, Dr.
That's helpful.
So one more question.
Okay.
Someone's asking if the students have been exposed to ventilator rationing.
As far as I'm aware, I don't think so. Now, we did see some interesting equipment. I'm not really sure. We weren't there long enough to really know exactly what was going on, but I don't think here yet. I know New York is really struggling with some ethical struggles on having to make decisions like that. But as far as I know, here we have not, in these facilities, there are some nurses I know that have seen that, but none of the students, as far as what I know, have not been exposed to that.
Okay. Okay. All right. We are going to wrap up questions now. We want to thank everyone for coming today. We have a whole series of these webinars scheduled for the rest of the month. And our next one will be Thursday at 1 p.m. with Dr. Ali, and he's a pulmonologist at LSU Health. So that'll be Thursday at 1. And that's it, Crystal.
Yeah, we hope you'll tune in. He's going to give a clinical overview on the coronavirus, and we're excited. Thank you, Dr. Marshall. Thank you so much
y'all
of your time. Thank you for everything that you're doing. Thank you to the students. there's anything that we can do, you know, to show our support for your staff and for the students, definitely reach out. We certainly want to make them feel our appreciation for all of their resiliency and their compassion and dedication to this profession. We are so grateful.
Yeah,
What
they're
you're doing
truly
now
amazing.
and what you do on a regular basis. You know, I mean, virus sort of heightens it all, but you know, there's life and death situations going on pretty frequently in the life of a nurse. So we're really, really grateful. And thank you for all the wonderful information. And we will see everyone back here next week, next Thursday. And everyone take care and stay well. Thank you.
Thank you. I
everybody.
appreciate it.
Thank you.
Thanks.